Welcome back to Good Day Alabama, everyone. 8:21 is the time. So how can radiation help in the fight against prostate cancer? Dr. Brian Larson from Urology Centers of Alabama joins us to explain this morning and take your questions. You can call in to Ask the Doctor at 741-7474. We'll go to our phone lines in just a moment, but Dr. Larson, thanks for being with us today. Oh, sure. Okay, two options out there for folks. If you are diagnosed with prostate cancer, you've got surgery or you've got radiation therapy, correct?
That's the usual the two main options for prostate cancer.
Tell me a little bit about radiation. How does this work?
Well, radiation is a less invasive treatment for prostate cancer. You don't have to have a big operation. A lot of people like that just because they may not want a surgery, or they may not be good candidates for an operation, age, other medical problems, things like that. So it's an outpatient procedure. And
is it a one-time thing? Is it an ongoing thing that you have to do multiple times, or how does
there's several kinds of radiation. The usual, when people think about radiation treatments, they usually think about the daily, Monday through Friday treatments. And for prostate cancer, kind of a standard treatment would be 7, 8, sometimes 9 weeks of daily treatment.
What kind of side effects are we talking about?
You know, most guys do really well. There may be some fatigue. You know, when you're treating down around the prostate, you get some effects on the bladder and rectum, and that can sometimes be a problem. If you have a big prostate already, it can be more of a problem. But most guys do really well. They keep working every day. They keep their normal activities, and it's a very attractive option for a lot of guys.
And if you are diagnosed with prostate cancer, I mean, heaven forbid, but if you are and you sit down and you talk to, this is one of those things, you'll talk to them, their doctor will sit there and say, these are your options, this might be where it's beneficial for you or maybe not. So that's one of those things to really ask every question you possibly have in that conversation. Hey, let's open up the phone line, see what folks are asking this morning. Herman's on the line. Herman from Calera. Good morning to you, Herman.
Good morning, Rick.
What's your question today?
Yeah, I'm wondering if prostate cancer is inherited.
Is it hereditary?
There's definitely a hereditary component. We don't really know all the causes for it, but if you have a father, brother, uncle, strong family history, you are definitely at higher risk.
And you definitely need to be, in those situations, you definitely need to go make sure to keep those routine screenings going on.
Oh yeah, and there's some racial differences. Black men tend to have a higher risk, and we tend to start screening those guys a little earlier.
Okay, Herman? Does that answer your question?
One more question.
Yes, so go ahead.
Are there any more symptoms?
You know, we try to catch prostate cancer very early, and we use blood tests called a PSA test that you can get at your family doctor as a screening test. And if we catch prostate cancer early, you usually don't have any symptoms. But you know, if it is advanced, you can get urinary symptoms or even spread to the bone and pain. But we really try to catch it way before that.
Is it a rule of thumb? And it's not. I guess it maybe not uniform. But if you start showing the symptoms, then you are kind of in that position where you need to start acting quickly and addressing the issue. You want to catch it before the symptoms show up.
Exactly. You don't want to wait for symptoms. You know, you want to be screened. It's kind of like women with pap smears and mammograms and things. You want to catch it before it ever starts giving you trouble.
Okay. Hey, thanks a lot for your phone call, Herman. We have Janie on the line from Centerpoint now. Good morning to you, Janie.
Good morning, Rick.
What's your question today?
My question is, if you have large prostate surgery, is it all right to drink alcohol, beer, wine, or whatsoever?
You know, I think people have different opinions about alcohol use. In my opinion, moderate alcohol use is not going to hurt anything, whether during radiation treatments, whether it's surgery or whatever.
And it's also based on what that doctor says too. If they say you don't need to be doing X during a treatment, then follow that advice, right?
Exactly.
Okay.
You know, some kinds of radiation for like the throat or the chest, you don't want any alcohol use. But for prostate cancer, for prostate treatment, surgery, radiation, I usually don't have a big concern about alcohol.
All right. Thanks so much for your phone call, Janie. A lot of good information today. Doctor, thanks so much for being with us.
Sure.
Okay.
You're welcome.
We now turn to JJ.